Hi, this is Hillary McElhaney, the nurse preceptor. Welcome back to my YouTube channel. I'm glad you're here. I wanted to remind you again, please consider purchasing my book, You're on Your Own, Preparing for the Impending Healthcare Crisis. Let me read the back to you real quick. Hello, 911, please hold. You're on your own. What would you do if someone in your family was injured or became ill? What if the hospital ED was full, there was civil unrest, or infectious disease was rampant? Do you understand basic medical principles? Do you have what you need at home to manage illnesses and minor injuries? Do you know how to perform basic medical skills? Learn to manage fever, rashes, pain, and wounds, apply splints, use over-the-counter medications, and more, written by an experienced nurse who cares. That would be me. Please purchase this. You can find it on Amazon. I will leave a link in the description below. And I will also leave a link to my personal website where I have a link to the Amazon purchasing area. Okay. Anyway, do yourself a favor. You're not going to be sorry that you have that book as a reference. Okay, so more bad news. Delivered with a smile, though. I'm going to be talking about shortages of medical supplies. Did you know that there was a shortage of some medical supplies right now? I don't really watch the news a whole lot, so I don't know if it's been on there or not, but I have really heard very little. Aside from the baby formula shortage, which is still ongoing, I've been looking everywhere I go when I'm out just to see what things are looking like, and there are a few cases of it here and there, a few canisters, but many, many open spots on the shelves. So something else to think about for any of you who are not medical people. The same companies that make the baby formulas generally make the tube feeds that patients get in the hospital as well. These are tube feedings are kind of like concentrated nutrition that people get fed by if they have a feeding tube. And it's a lot of times it's people in the hospital, but it can also be people who may require that at home for some reason or another. So if there's shortages of baby formula, there's shortages of tube feeding formula as well. But there are spotty shortages of specific products where different hospitals and the logistics people are having to substitute one product for a similar but not the same product. We're seeing that. I know some people who work in supply chain, and I am hearing some interesting stories about having to piece together sterile kits so that doctors have everything they need to do procedures at the bedside. Okay. All right, so I'm going to give you two references here. The AAMC, which is the American Academy of Medical Colleges, aamc.org, and the FDA.org. So these are the supplies that are in shortage right now. So we have CT contrast media. This is the stuff that is either injected or you take by mouth when you're having a CAT scan done. It allows the radiologist to be able to visualize the tissues and the spaces inside your body. So it's kind of an important thing to have. Gowns, masks, and gloves, all on short supply right now. Laboratory reagents, testing supplies, blood test tubes, pipettes, culture media, respiratory sputum collection kits. Basically, that's the stuff that the lab technicians use to run lab tests. That's important in the hospital. We run a lot of tests. Ventilator-related products as well as new ventilators. That's not good. Chest tubes with autoinfusers. We use these during trauma and during surgery. If someone is expected to lose a lot of blood into their chest cavity, we get the blood drained out, and then we're able to reinfuse that blood back into them so that it's not a complete loss of blood. And it's really a shame if they're running short on those right now. Suction canisters, we use them for all kinds of things. We use it to suction people's mouths when they're on a ventilator. We use it to suction out their respiratory secretions when they're on a ventilator. And we also use it to keep people's stomachs pumped empty if they have a drainage tube in their stomach. AEDs, so automated electronic defibrillators. Apparently it's a chip thing. Anything requiring a semiconductor chip, so that would also include your ventilators. They are mechanical. This would also probably include like your IV pumps, all of the surgical equipment, all the equipment that you see in the radiology suite, the equipment you see in the cardiac cath lab, these are the reasons that people go to the hospital. So if we don't have the high-tech stuff, our hospitals don't have a whole lot to offer people. Dialysis products. When people are having to receive dialysis a few times a week to replace their failing kidneys, that is like life support. Dialysis products are in short supply right now. I'm assuming the machines are as well because they are also automated, therefore requiring semiconductor chip. All right, and I was looking a little bit further down on these websites. The estimated resolution is the end of 2020 for many products. That's just a best guess, assuming there are no further supply chain issues and supposing that the railroad workers decide not to strike and that the truckers decide not to strike. So we will see. What we are seeing as solutions right now is using supplies beyond their expiration date. I'm really not supposed to do that, but I suppose having, an IV catheter that's a few days overdue is probably better than not having one at all, right? Finding alternatives, like I said before, having to substitute one product for something similar, yet not the same. Because when you substitute one product for another, typically you're substituting the product that your hospital or your system has a really, really good rate on for one that's more expensive that you don't have a contract for. So the prices go way up. And I will tell you, just having worked in a hospital where they suddenly overnight changed the IV catheters from one brand to another, there was a learning curve with the switch. I mean, yes, they're both IV catheters, but they work differently. You have to insert them differently. The mechanism is different. And it took me probably a few really rocky days at work where I missed like every IV that I tried to start because I couldn't figure out the new equipment. So makes way for errors and things like that. So what is driving this supply chain shortage? Well, part of it's the supply chain coming from China. They've had a lot of shutdowns, a lot of drama there. We have had a backup at the ports importing things. And lately, there's also a decrease in European manufacturing because of the electric prices and the energy prices. So, the things that happen over there actually do impact us here. So pay attention. And then the lack of supply chain diversifications. Oh, we don't have a whole lot of redundancy in the system. Like there's one company or maybe two companies that make a specific product, and that's it. And if something happens at that factory, or if the workers go on strike, or if the country shuts down for some reason, you're SOL. You are up a creek without a paddle. So yay, that's great planning, guys. And finally, the just-in-time delivery approach, where they order just enough stuff to get through a few days, expecting those trucks to keep on showing up with regularity. And welcome to the new normal, people. Things are just going to have to be different, right? I think part of this is about expecting less, like having lowered expectations. So, I hate to say it, get my book. You're going to be needing this at some point. Don't wait till you need it. Get it ahead of time. You're on your own, preparing for the impending healthcare crisis. I will leave the links to my book in the description. Thank you. I hope that you have enjoyed this. Like, share, subscribe. I'll be here. Bye.